Recording. This is Dr. Sarah Wooten, and this is the monthly All About Cats Ask a Vet Anything forum. So I am going to be here for you, and we are going to be answering questions as soon as our audience is able to get on. So in the meantime, if you're watching the recording of this, bear with us as we get our audience into our studio. Virtual studio, I should say, not a real studio. I see 8 eyeballs. So I can see that people are actually able to log on now. So that's amazing. Perfect. I will wait probably another 20 seconds or so to see about getting more people into our session, and then we will get going. So welcome to everybody who is logging on right now. I am Dr. Sarah Wooten. I'm here to answer your questions. For the few of you that are here already, if you have a question, I would recommend getting it into the chat as soon as possible because the questions tend to pile up on each other pretty fast. And if it gets down to the bottom, I often am not able to address the question. So the sooner you can get that question into the chat window, the higher likelihood I am to be able to address it today. So hello, everybody. I am Dr. Sarah Wooten. I am a small animal veterinarian. I graduated from UC Davis in California, which is in the United States. Back in 2002, I practiced veterinary medicine in small animals, including cats, for 16 years. And now I am here to answer any question you have in regards to cats. So a couple of things. One, if you have a question that you would like me to address, stick it in the chat window sooner than later. Like if you have a question in your mind right now, stick it in the chat window because the thing is, as we go on, the questions tend to pile up on each other pretty fast. And I can't get to the ones at the very bottom because there's such a big pile of the questions at the top. So even if you're not sure what your question is, throw something in now, then I can address it. Secondly, as more people are logging on, welcome. Hi, everybody. It's been a month. Can you believe it's a month and we're all still here in this wonderful dimension called planet Earth? Yay. I'm Dr. Sarah Wooten. If this is your first time, thank you so much for joining me. I am a small animal veterinarian, and I am here to answer your questions. Couple of things I have to do at the very beginning. Disclaimer. Anything that comes out of my mouth and is said to you during this hour should not be construed as medical advice or a substitute for the advice of your local veterinarian. This hour is for educational purposes only. So if you do have questions or concerns about actual treatment of your particular animal, you're going to need to talk to your vet about that because legally I can't advise you unless we have a relationship, right? It's called the veterinarian client relationship. So I can see that you guys are already doing an amazing job about putting your questions in. So that's awesome. Thank you so much. And I see a couple people have said hi. Hi, Anna Maxa. Hi, Cloud and Sky. Hi, Reach Kevin Wang. I'm so glad you guys are here. So what we are going to be doing is, if you have questions for me, I'm going to sit here and I'm going to share as much veterinary knowledge as I can with you in the next several minutes. We have about 55 minutes here together. So I'm going to stop with what I'm doing and I'm going to get to your questions, okay? So question number 1, why do my cat's ears get hot and cold within 10 minutes of each other? Well, fabulous question, Diane Davis. So if you've ever looked at your cat's ears closely, you will see that there is a large network of tiny blood vessels that are all over the surface of that ear. Cats do not sweat or pant generally to regulate their body temperature, so they have to do it in different ways. And one of the ways is they can gas heat out of their ears, for lack of a better word. So if a cat's ears are very warm, it's because there's a lot of dilation in those blood vessels in the ear, and they are letting off steam. They're literally letting the steam come out of their ears, like those old cartoons. Well, that's your cat. And then once that heat is dissipated, then there's no longer any reason. A signal is sent to those blood vessels to constrict back down. Boom, then your ears get cold. So hopefully that is a quick answer to your question. Here is a question from Vivienne. Vivienne, my love, thank you for asking. How can I help a kitten that is teething? Great question. So in case you don't know, I've got to get myself some skull models around here so I can give you guys a better idea. But in a cat's head, actually, hold on. Nope, I don't have it. I was going to grab a picture of a cat skull. So in a cat's head, they have 2 sets of teeth. Okay, so they have 2 sets of teeth. They have baby teeth, and then they have adult teeth. And in between about 6 months of age-ish and about 10 months of age-ish, they lose all of their baby teeth, which we call deciduous teeth. And the reason why we call them deciduous is because they're like deciduous trees, which lose their leaves once a year, versus evergreen trees, which don't. So these cats will lose all their baby teeth, and then they will get a whole new set of adult teeth. They have 30 adult teeth. So while they're losing their old teeth and gaining their new teeth, they may want to teeth and chew on things. And so the other thing is, kittens are naturally very curious, and they explore the world with their mouth. And so it may be partially teething, and it might partially just be curiosity. But we don't want curiosity to kill the cat, right? We don't want them chewing on electrical cords or anything like that. So how can you help these cats when they're teething? Well, you can take treats that they have, and you can put them in the freezer so that they can chew on these treats and get kind of that cold feeling. You can, cold is your friend. Cold is your friend. You can also, if it's really bad, you can talk to your veterinarian about pain medication. Generally speaking, it is not that bad for cats. Dogs tend to be really a lot worse with the teething than cats. But if cats are teething, you can offer them treats that are cold, because that will help. And if that's not enough, then you are going to want to talk to your veterinarian about pain medication. Also, during this time, they're going to be looking for things to chew on. So you need to get down on all fours, and you need to look around your house and make sure that it is kitten proof for their curious little mouths, because they're going to want to chew on everything. And I am talking about electrical cords. Electrical cords. Cats chew on these things all the time, and they get electrocuted. Ugh, we don't want that. The other thing that cats tend to go for when they're teething, or even after, is they tend to go after hair ties, like the little round hair ties, not the big scrunchies, the little round rubbery things, or the little stretchy guys. Maybe it's because it smells like you, I'm not sure, but they tend to like to chew on them, and sometimes they swallow them, and that can cause life-threatening gastrointestinal obstructions. So pick all that stuff up, cover your cords, make sure your kitten chews on only the things that you want. If you cannot control them all the time, make sure you have the cat in a small controllable area when you are not with them, because these kittens are like toddlers and they need supervision. Okay. Here is somebody who wants some help with feline asthma. Oh my goodness gracious, feline asthma is no fun. And in fact, I have one of my big books here, right? So I can get you guys all the latest and greatest that is available from veterinarians. So this is the latest veterinary consult book, which is kind of our Bible that often many of us are using in practice so that we know what to do. Okay, so cats, if you don't know, can get asthma, and it's usually due to allergies. They are exposed to something in the environment that causes their airways to constrict down. Don't mind me, I'm just grabbing my heavy book. It's really heavy. They can also get bronchitis, which is inflammation of their big airways. And so there is what happens is they get asthma attacks just like humans, and it causes them to feel very panicked and short of breath. And they can actually be life threatening in some cases. And so usually what happens is they're inhaling something that is either irritating, like smoke. Secondhand smoke can be very irritating to cat airways. And that's not just cigarette smoke, my friends. That is also smoke from the cannabis, right? This can be really irritating. What it causes is all those muscles that are in tiny little muscles that surround the airways to constrict, right? And so this can cause problems. So what we want to do is we want to be able to help these cats when they are having an asthma attack. They are having difficulty breathing, right? They're having a hard time usually breathing out. Expiration is where you'll hear a lot of that wheezing and that whistling that's coming from their airways. Sometimes they cough. Oftentimes they'll sit with their head and neck extended. Let's see if I can do a good impression. They'll sit on their elbows and they'll sit with their head and neck out. They'll often have their eyes closed and they'll look like they're really struggling, right? So cigarette smoke, dust, dusty litter, these are all things that can cause, potentiate feline asthma. Hairspray, air fresheners. And again, I'm looking over here at my book to make sure that I'm giving you all the accurate information. So the thing is sometimes asthma can mimic other disorders, things like pneumonia or heartworm disease. Heartworm disease can mimic the signs of asthma. Also, we have things like primary lung tumors that can also mimic the signs of asthma. So if you think your cat is having difficulty breathing, you need to make sure that that cat gets a diagnosis on what's actually going on. And that usually requires some lab work and some x-rays. And funny thing that we're talking about this because I just filmed a whole long video on heavy breathing in cats that should be up in the next couple of weeks, hopefully on YouTube. So I'm actually pretty fresh on this topic. So how can you help this cat? Well, make sure that that it is asthma, right? Get the cat tested. Also, make sure that they're testing the cat's fecal exam. So they're testing the cat's poop or any kind of parasites because lungworms, heartworms, and even whipworms and roundworms and hookworms can all migrate through the body, including through the lungs, and mimic some of the signs of asthma, right? Because they cause the worms migrate and they cause inflammation, and then you get the signs of asthma. So all of that to say, what do we do, right? So we are going to want to make sure, first of all, that these cats are thin because asthma is exacerbated in overweight or obese animals. So making sure that this cat is at a healthy weight. Secondly, you are going to want to, and again, look at my book, it's here. You're going to want to manage the environment. You are going to want to reduce dust and pollen and any irritants in your environment. So you want to stop using your aerosol sprays, your air fresheners, stop smoking inside. Make sure that your air inside is pristine. Use a HEPA filter, use air purifiers, vacuums that have HEPA filters. Cover the cat bedding in plastic or wash the cat's bedding once a week in a unscented hypoallergenic laundry detergent. Okay, so you want to reduce the allergens that this cat is exposed to. All right, so take away the inciting factor. Then you're going to want to make sure that this cat has the appropriate medication. So there are several different medications that you can use for cats that have asthma. The classical one is just steroids and bronchodilators. You have to be careful which bronchodilators you use in cats because it can have other negative side effects. So you have to work closely with your vet. And no, you cannot use your human inhaler on your cat. Don't do it. So bronchodilators and steroids, pretty typical. Now, steroids, they also can utilize other immunosuppressive drugs, such as cyclosporin. It gets varying effects, right? Steroids, these cats, if you keep their environmental exposure down, you don't tend to have to use the steroids as much. Steroids can come in an oral pill, they come in a liquid, they come in an injectable, they come in an inhalant. So you can actually train these cats to wear a little mask where they have an inhalant. So like a Pulmicort, which is a human drug, you can get that same kind of idea for a cat, right? And not all cats will tolerate that, but a lot of cats will. So there is a lot of options. If the cat is really having a big asthma attack and cannot breathe, that cat needs immediate veterinary attention, needs to go to the vet, needs to sit in an oxygen cage and calm down until you could start the other drugs. And then as far as bronchodilators go, there are different ways to do those as well. They come in inhaled forms, they come in oral forms, things like that. And then oftentimes a lot of veterinarians will elect to deworm these cats too, because so often they are carrying some unknown worms, right? If cats have worms, you may not even know it sometimes. So a lot of times people will have, or veterinarians will deworm these patients as well. Couple of things with the steroids. Steroids are great for the short term. They are terrible for the long term because they have a whole bunch of negative side effects, including messing with the adrenal glands and messing with the pancreas and predisposing these cats to development of Cushing's disease and diabetes. So you have to use the steroids as sparingly as possible. You don't want to use them all the time, and you really want to focus on your environmental management as much as possible, because avoiding the allergen or the stress is going to be helpful. Okay, I've said a lot about that. Let's see what other questions we have. Okay, all right. Oh, this person's going to get me in trouble. Things you don't talk about on the internet. Pet food nutrition, politics, religion, COVID-19 conspiracies. And this is one of those topics, right? People have very passionate opinions about what we should be feeding these animals. So here's just a question about safety on raw food and kids in the house. So generally speaking, raw food is not a human health issue as long as it's handled correctly and the human does not have any kind of immunosuppressive issues. So immunosuppressive issues, very, very young, like a baby, very old people. And then people who are on immunosuppressive drugs or have had HIV or have had organ transplants. Those particular, or if they have hepatitis or something, those particular population demographics of people, if you have a cat, I do not recommend handling raw food. I don't recommend even feeding raw food. If you really want to feed raw food, you're going to have somebody else feed your cat that. And then you have to make sure that that animal is not licking your face, right? But generally speaking, most of the raw, and you have to make sure you're sourcing your raw food from a reputable source that can help ensure that the bacterial counts on that food are not high. So in general, whole pieces of raw meat or raw products, because obviously we feed the cats lots of different parts, not just the meat, the muscle. The products that are solid, like a solid piece of whatever it is that you're feeding to your cat, tend to be safer than, say, the ground products, because the ground products, any of the bacteria that was on the surface gets ground right in. And so you always want to, make sure to wash the outside of it. And then obviously I would use gloves. I would disinfect your surfaces. I would even have a special location and special containers and tools and everything just for those raw products. And then if there's any issues with immunosuppression, then don't go there. As far as kids go, most kids fairly healthy, right? Most kids have really great immune systems, and being exposed to tiny amounts of possible commensal bacteria that is on the surface of a raw product, immune system can probably take care of that. If the animal is getting sick off of raw products, then that could be a concern for humans as well. But in general, I went over the populations that should not be using raw products. Other than that, I would stay away kind of from the ground products. And that's about all I have to say on that. Okay. Hopefully that answers your question. Hmm. I'm just looking at your questions now as I go through. Okay, here we go. Millie wants to know, how can I prepare for my cat's first vet visit? Millie, you are a rock star. Thank you for asking this question. Thank you for being proactive in the way that you're considering this. And thank you for coming here to seek knowledge. So there are so many things you can do to help this go really well. As a veterinarian, I always appreciate it when an animal is not afraid when they're at a veterinary hospital, because when the animal's afraid, that just adds in a whole so many other levels of difficulty. I mean, then we have to sedate the animal, and then the animal gets stressed, and maybe the cat develops other problems because it's so stressed, or maybe the cat doesn't get to go to the vet as often because the cat is so stressed, and it's a terrible experience for everybody involved. Fortunately, there are so many things you can do to make sure that your cat's going to have a good trip. The first thing I want you to do is I want you to go on your internets, and I want you to look up fear-free pets, or it might be fear-free happy homes. That is a wonderful website on all sorts of tips on how to make veterinary visits less stressful for your animal and for you. So go to Fear Free Happy Homes or Fear Free Pets. I think it's Fear Free Happy Homes, and go and read everything that they have. And think about things ahead of time, like Millie here is doing. So if she's going to be taking her animal, her cat, to the vet in maybe 2 to 3 weeks, now is a perfect time to start getting that cat used to and socialized to the crate, because the crate could be a source of stress and terror for this cat that's never had an experience with it. So you're going to want to have your crate, and then you're going to want to leave the crate out around the house. You're going to want to put nice things in the crate. You're going to want to leave the door open. You're going to want to put maybe some treats in there, maybe some soft things for the cats to lay on. Maybe you want to spray it with some pheromone spray like Feel Away to help it be more positive. Maybe you want to feed your cat in the crate, and you let your cat go in and out the whole time. And then during that week, once the cat seems like they've accepted the crate and they're happy with it, practice with short times where you close the door and then open back up and make it positive, right? Then maybe a couple times after the cat's good with that, maybe you pick up the crate and you put it down, and you pick it up and you put it down, and then you let the cat out, right? So the cat does not come to associate the crate with the dreaded veterinary hospital. That's the idea. You're building a positive association with this crate. Maybe once the cat's comfortable with being picked up in the crate, then you take the crate out and you put it in the car, and then you pick it up and take it back inside. When you put the crate in the car, you're going to want to prop the crate up by the chair part with a towel so that the bottom of the crate is level. Because even with the crate in the car seat, most of the time it's tilted, and that is also very stressful for your cat, right? So you want to make sure that they're comfortable with the crate. You want to make sure that they are comfortable with you touching different parts of their body, because the vet and the veterinary technician is going to be all over your cat, touching their ears, looking in their mouth, touching their paws, listening, feeling up their belly, lots of different things going on. So making sure that your cat is comfortable with that. Beyond that, go to Fear Free Happy Homes. There are so many tips on there that will help you to make this a positive experience so that you cannot be as stressed and your cat won't be as stressed, and you can get the veterinary care you need without it being a headache. Okie dokie. Lynn B wants to know, what flea heartworm medication do I recommend? Well, if you want something that is all-inclusive, that has a long history of being safe in most animals with a very low adverse event report, so All of these medications I talk about, they have adverse event logs that the companies log to make sure that their products are safe and not harming people. One of the ones that's been around since before I graduated from vet school, I feel, is Revolution. Revolution is a wonderful product because it is extremely effective. It is very broad spectrum. It will get just about every bug that's out there. Don't think it gets tapeworms. Let me make sure. Tapeworms. Revolution. Tapeworms. Revolution Plus. Nope, it does not. Okay, so if your cat has tapeworms, that's the only thing that it doesn't really get. But fleas, heartworms, mites, many different intestinal parasites as well. Revolution is excellent. If you don't want something quite that broad, you can actually do, hold on, I'm looking stuff up for you guys because I want to make sure I have the most accurate, up-to-date information. So if Revolution is not your thing, then you could do a combination of, you could do HeartGuard. HeartGuard is another option that is out there. You can do CentriGuard. That is one that's out there. Then we have for flea and tick, that is really great. Just flea and tick is Bravecto. Bravecto is an excellent newer class drug that is very effective. So those are the ones that I like and I tend to recommend. Okay. All right. Question about pumpkin puree. Pumpkin puree. How often should I give kittens or older cats pumpkin puree? Vivienne, you have beautiful questions. Thank you for asking them. So again, this is a very individual answer because not every cat is the same. Typically speaking, I don't tend to give kittens pumpkin puree quite as much because they're trying to figure out their guts anyways. But if you were going to give a kitten pumpkin puree and they really liked it, a couple of licks, a couple of times a week should be fine. Older cats, you can do upwards of a teaspoon a day, a teaspoon of pumpkin puree a day. Some cats do well with 2, some don't do as well. How do you know whether they're doing well? Well, if you have constipation or diarrhea, you're giving too much. You got to cut it back because too much can block a cat up, some cats up, and too much can cause diarrhea in other cats. So 1 teaspoon a day to every other day is a nice probiotic fiber supplement for older cats. For kittens, a couple of licks a couple of times a week should not cause any problems. But if you notice any problems with stool, stop it. Don't do it. Okay, next question from Denise, my friend. Her cat loves the dog's toothpaste. Is it safe? He hates the malt cat one. Oh, girl, yeah, that stuff is crappy. Blech, doesn't taste good at all. Yes, that dog toothpaste is 100% safe for your cat. Go ahead and give them the toothpaste, and kudos to you for being interested in your cat's oral health. Some of you guys are comedians. This Anna Maxis said, it's only 10,000 questions in an hour. You can't handle that many? Oh, okay. Oh, Morgan, my friend, I'm so sorry. Morgan has a cat with separation anxiety. Hi, Sarah. I have a cat who starts to cry within a minute of me leaving my house. Any advice to stop the crying? I have to travel for business and feel sad. Oh, don't feel sad. It's okay. So your cat is struggling with separation anxiety. It used to just be mostly a dog issue, but the more we learn about cats, we understand that they are sensitive, emotional creatures, and they have issues too with separation anxiety. So what you're going to have to do is you're going to have to work with your cat to desensitize them to the stimulus of you leaving and counter condition them with a different behavior or a different feeling. So you want to build an association in your cat's mind that anytime you leave the house, that means fun, awesome things happen. So Unfortunately, this doesn't typically get fixed in a day. Because the cat's been building this behavior for a while, it's going to take a little while to undo it. It takes patience. It takes some time on your part. If you're really interested in doing this, I recommend working with your cat over a several day period when you're not going anywhere, maybe a weekend or something. And what you're going to have to do is you're going to have to not trick your cat, but desensitize your cat to the stimulus of you leaving. So this is best done in conjunction with working with a certified feline behavioral specialist or a veterinarian who is board certified in behavior. The cool thing is you can often do a lot of these consults via telemedicine right now, like via Zoom. You can send them videos of what your cat is doing, and they can send you back a treatment plan, because again, this is not going to be fixed in one day. So historically speaking, what we often used to do, and I'm not proud of this, is we would give you some medicine that would knock the cat out, and then you could go about your day and not have any problem. And oftentimes that medicine was acepromazine. Acepromazine has its place, but it's not a good anti-anxiety medication. I hope you all heard that, because this is not universal. We used to prescribe it all the time for anxiety, but all acepromazine does is it makes the animal immobile and drops their blood pressure and their heart rate, but it does nothing to reduce anxiety. So imagine being this poor cat or dog given this medication, and then you can't move and you're still feeling anxious, right? So it actually compounded the problem. So I don't recommend acepromazine for that at all. There are other prescription anxiety medications and calming aids that you can use that can help reduce that anxiety. But the most important thing is to be able to work with your cat so that your cat does not get to that anxiety threshold where they start meowing. And this is kind of, if you haven't noticed, this is kind of a complicated answer because it involves calming aids, whatever works best for your cat, whether it's prescription anti-anxiety medication or it's some sort of over-the-counter supplement or whatever. All of those things are just designed to raise the anxiety threshold, so it takes more for the cat to kind of lose it, and that gives you more time to retrain the cat. The second thing is you have to train your cat to not freak out when you leave. Oftentimes, cats or dogs that have separation anxiety start the anxiety train long before you even touch that doorknob, because they pick up on our subtle cues that we're going to leave. Picking up the keys, picking up your purse, maybe getting your jacket. Things like those, your animal is always watching. And if they have associated that cue with you leaving, they may start the anxiety even before you go. Isn't that crazy? So you have to be very mindful to see when your cat starts to change their behavior. Maybe they just get clingy before you leave, or maybe they get stiff before you leave, or things like that. Let you know that they are already starting to get anxious. Once you know what the initial trigger is, you have to start with that initial trigger. So maybe it's just, let's be simple here and make sure, maybe it's just when you open the door and leave. That is the stimulus that causes your cat's anxiety to go up. Well, you've got to train your cat that when you do that, it's no big deal because you're going to be back soon. So you have to literally get your calming aids in place, whatever it is that you're using to help your cat feel more calm, right? Maybe you give your cat some treats when you leave so that they realize, oh, when mom leaves, something delicious happens. Or maybe you set up a food puzzle or something fun for them to do when you leave so that they are not just sitting there and stewing in their anxiety. So you get your calming aids, you get their distraction, and you go out the door. Here's the clue. You got to come back before they get anxious. That's why you need several days. And this is going to be your project for several days. So you go out and you stand outside the door for 15 seconds. And then you come back in and you sit down like no big deal. Do not reassure your cat. Do not comfort your cat. Do not pay attention to their behavior at all, because if you do so, you will reinforce the anxious behavior. This is one thing that is a little paradoxical for people to understand, but you cannot comfort an anxious animal because they'll think, oh my God, if I act like this, they'll give me more attention. So you go out the door, you leave for 15 seconds, you come back in, you do whatever. 10 minutes later, you go out the door, you leave for 20 seconds. Then if the cat's okay, then you can do this over time where you're slowly lengthening the amount of time that you are gone. That builds trust with your cat that you're coming back. If at any point your cat starts to meow, 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 get anxious, you've gone too far. You have to dial it back to when the cat is not anxious and work below that threshold. Once the cat's anxious, you're done. You're done, right? So this can take several days. And having some sort of anxiety medication or supplement or something in place and somebody to guide you in it is really helpful. Okay. Patience, distraction, calming aids, lots of short training periods. And then the goal is that you can work up to a longer period of time to where maybe you're gone for 10 minutes and the cat doesn't start freaking out till 10 minutes. Awesome. Maybe next time it's 12 minutes. Every cat's unique. So also Google separation anxiety in cats, and there will be more tips there for you as well. Wow, I just said a lot about that. Let's keep going. Ooh. Can you please talk a bit on whether or not we should really start our boys on probiotics? They are 11 months old. Yes. So I don't know if you guys know this, but the mammalian body, whether it's a cat, a dog, a human, whatever, it's actually, we have more bacteria, or we have about the same amount of bacteria as we do human mammalian cells. Same thing goes for cats. That bacteria lives in our gut. It lives on our skin, lives on our eyelashes, lives in our mouth. It's everywhere. We coexist with this bacteria. The problem with our current way that we think about being healthy is we kill the bacteria with hand sanitizer. If you think about it, you're in effect killing part of yourself. Stop doing that. So the question about probiotics comes into really big, important parts of discussions, especially because a lot of research these days is focused on the health of the microbiome. The microbiome is all the bacteria that you live with, inside and out. And it doesn't matter if it's gross or you're kind of squeamish about it. It just is what it is, right? So the sooner we can all get comfortable with it, the better we'll be. And we have to make sure that this bacteria is healthy. A lot of these bacteria do things for us. They keep other bugs from overgrowing. They help us digest food. We live in synergy with these microscopic animals. And a lot of commercial foods lack the necessary probiotics that, say, a cat in the wild would get from just being in nature. They accidentally ingest microbes all the time, and they're much more in tune with their environment than our domestic indoor cats. One way of combating this is by feeding your cat a high-quality probiotic. What that does is that helps repopulate the gut with healthy bacteria that is supposed to live in partnership with us. In essence, you are putting more good guys into you, which will outcompete the bad guys like Salmonella or E. coli or Clostridium difficile, things like that. This bacteria can actually protect you against infections. It's awesome. So if you are thinking about starting an 11-month-old kitten on probiotic, go for it, okay? What you'll find is a lot of foods these days actually have guaranteed probiotics in the foods themselves. And these are the dry foods. I'm not sure about canned foods. You have to look on the label. But you want to look for guaranteed live CFUs, colony forming units. And you want millions of these guys, and you want several different strains. They even have said that our bacteria are responsible for things like mood. And in fact, Purina has a probiotic. Remember how we were talking about calming aids? They actually have a probiotic that has several strains that they have found actually promote a calm demeanor in cats. And it's a Fortiflora is the product, and it's Calm, Fortiflora Calm. Wonderful product, right? Especially if your cat's anxiety is due to a gut imbalance or a intestinal overgrowth. So make sure you're getting a quality product. It's totally fine. If your animal is on any kind of antibiotics, you want to make sure that they are fed probiotics at least an hour separate from the antibiotic. Otherwise, the antibiotic's just going to kill the probiotic. The other thing that's really important is to make sure your cat is getting prebiotics. Prebiotics are things like fiber. Beet pulp is a prebiotic that help feed the intestinal cells, the cells that are part of the gastrointestinal system. And so that's really important because you need a healthy gut in order to be able to digest all of your food and house all of these microbes. So again, super long answer, I apologize. Short answer, yes. Go for the probiotics. Go you. You guys are awesome. So it seems like this is, I think, more questions about feline asthma. So they tried Flovent, and Flovent is a inhalant medication for feline asthma, and it caused massive nasal congestion. Well, that's not good. We don't want that. Oral steroids help, but it's not something good long term. Is there an alternative? Let me see here, my friends. Long-term management. I still have it open. So I would say Flovent is your fluticasone. And that is not working out for you. So I would say there's no support of using antihistamines. And I would say if you are running into issues with one of the major inhalant steroids that is prescribed for cats with asthma, you really need to talk to a board-certified internal medicine specialist, because they may have access to different drugs than just us regular old doctors have access to. So, and in the meantime, you can look at alternative steroids for now. I'm going to look up one more thing because I want to help. Another one you could try, and I'm not sure if this will actually work. So again, not medical advice, not medical advice, but Pulmicort. The Pulmicort is a human inhalant steroid. It's also called, so the generic of that is budesonide. Budesonide. Budesonide is a wonderful drug because it's a steroid. It's kind of like a steroid, but it stays in the organ where it's meant to go to. And it's used in cats that have inflammatory bowel disease to control that, because it's nice because it just stays in the gut. So Pulmicort is nice because it would just stay in the lungs. Not sure if it's an option, but maybe talk to your vet about budesonide as an option for treatment, especially since it seems like the Flovent's not working out for you. My cat's lip seems to be swelling. I got an appointment for her this coming Monday. What is causing her lip to swell? Well, my friend, I am not sure. It could be a rodent ulcer. Let's see if I have a picture for you. So lots of things can cause cats' lips to swell. So let's start with common things like allergic reactions. Allergic reactions can cause a cat's lip to swell. And that generally you can get it from an insect sting or a bite. Maybe they, something like that. Other things that can cause a lip to swell: abscess. So the face is where cats tend to get abscesses, mostly in two places. They can get them anywhere all over the body, but they tend to be in a couple of different places, on the face or on the butt. Tends to be where these abscesses show up. And if they're on the face, then you've got a fighter because their face is in. And then if they're on the butt, you've got a runner because they're getting in there as they run away. And what happens is they get a tooth or a claw or something in, it punctures, seeds bacteria under the skin, boom, you have an abscess. So that is another possibility of what it could be. That is, can be just firm, or it can also drain pus out of it. So in which case, it would be really nice if you could have your cat seen sooner, because if it's either of those can be really painful, and it would be just nice for your animal to get relief sooner. Okay, now I am going to show you of another possibility of what it could be. And again, friends, I'm just shooting from the hip because I haven't seen your cat. Oh. Indolent ulcer. Indolent ulcers can be due to hypersensitivities. Those are also due to allergies, and they're very common, right? It's also called a rodent ulcer because they used to think it had to do with them hunting. And so I don't know if you can see, but on this picture right here, this lip right here is swollen. And then here's another picture that shows you how this can affect this animal. So it could be allergic, could be infectious. Either way, see if you can get your cat seen sooner so that your cat can have some relief, okay? Dun, 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 dun. What do we have next? Hi, everybody. Okay, here we go. Spay Vivienne. Please tell us about spaying and neutering aftercare. Great question. So when your cat male cat has their testicles removed, it's called neuter. When a female cat has their uterus and ovaries removed, it's called spay. Those are just kind of the common terms. So it's very important that these cats stay quiet after surgery and keep their incisions clean and have their pain managed. So naturally, a neuter, which is the testicle removal, is very different than the spay, which is a full abdominal surgery. They're probably both the same in pain, so we do pain management for both. So for a neuter, there typically is 2 incisions on either side of the testicle. I apologize for all the men that's listening to this. I understand this is a comfortable conversation. I'll do the best I can. Usually 2 small incisions, and then your cat is usually sent home on some pain medication, and they're told to keep quiet. I have found most of the time, if you can keep your cat quiet for like 2 days after a neuter, a male cat, if you can keep them quiet for like 2 days or so, they tend to heal it pretty fast. Sometimes people will put the cones on them. Sometimes that works. Other times that just drives the cat completely bonkers. If the cat has their pain properly managed, they should not lick excessively at their site. They only lick excessively at a surgery site if it hurts and it's bothering them. So if you have the pain managed, it's okay that they have these 2 little incisions back there and maybe they lick them every once in a while. That's okay. Feline females, on the other hand, they have a full abdominal incision. So they'll usually have the incision right around their belly button, usually like right behind their belly button. And it's anywhere from like this big for the really good surgeons to this big in surgeons like me. And then they need to stay quiet so that that incision can heal. And incisions don't heal lengthwise. They knit together side to side. So it's really important that the tissue stays still so that the cells can migrate over the incision and everything can get healed up that way. If there's too much motion, then that causes inflammation at that site, which can lead to swelling, pain, lots of problems. So it's more important that female cats stay quiet longer. I ideally would like them to stay quiet for at least 5 days. If you can get 7 days out of them, perfect. Some people put and then prevent them from licking by making sure that you're checking them every day and making sure their pain is adequately controlled. Remember, cats only will lick if it hurts or if it's bothering them. So if you have them on good pain medication, they should leave it alone. Females can use those cones, or you can get them fitted with like a small t-shirt that will cover up their incision. And then you have to check the incision every single day. And you need to look for a couple of signs of infection or inflammation. So if you see excessive redness in the skin, if it's hot, if the skin is hot to the touch, if it's more swollen, or if there's discharge, any kind of oozing out of it, gross, or if there's a bad odor to it, or if your cat is acting sick in any way, vomiting, diarrhea, hiding, lethargy, things like that, signs that there is a potential infection at that incision, call your vet. When they come home, so if they come home same day from surgery, they can have some small amounts of water each hour for the first night. And then they can have a small meal, like maybe a quarter to half of what they normally eat before they go to bed. Make sure you give them all their medications as prescribed all the way. And then the next day they can go back to a more normal food, but it's important that they stay quiet and don't lick. Stay quiet, don't lick. And if you see any of those 5 signs, swelling, heat, discharge, redness, or odor, call your vet because that thing is infected. Okay? All right. Hello, everybody. Hello, hello, hello. Okay. Dave, thank you for telling me that you appreciate my time. I appreciate you as well. Here's a good one. Vivian, my kittens are in a room now. How do I teach them the litter box won't be in there in the future? Well, the easiest way to do that is to take the litter box and wherever it is that you want it to go eventually, start migrating it that way day by day by day. So each day you move it maybe 1 box length towards where you want it to go. And then the next day you move it another box length. And then the next day you move it another box length. And then migrate it that way. The other thing is you could leave the box where it is and then put another box where you want it to be and then let them use both. And then if they start using the new one, then you could take the old one once they start using the new one. That's another option. Also put some feel away around it, make it nice, make it a nice place. Litter boxes need to be in a warm, quiet, low traffic area. And as much as we want to put them in the laundry room or the furnace room, not a good idea because cats don't tend to like the noises off of the washing machine or the furnace. And oftentimes these cats will stop using their box and they'll go use your bath mat or your laundry. Okay, so that's a couple of things there. How is this time going so fast? How is this going so fast? I just started and there's like 1,000 messages here. Okay, I'm going to do the best I can with the 7 minutes I have left. Okay, here is a quick question. Good afternoon. Can you please talk about a cat vomiting after eating canned food, even after food quality and brand have been addressed? Great question. That means that there is something wrong. Duh. Doctor, you need a doctor to say that, right? So there's something causing your cat to vomit that has nothing to do with the food quality. It could be anything. I mean, it could be anything, right? It could be an ingredient sensitivity. Maybe they don't do well with chicken or beef or pork or something like that. Maybe they have an inflammatory bowel issue that needs to be addressed with a special diet and some medication. Maybe they have worms. Maybe they have some other problem in the body that is impacting their intestines in such a way that even if you feed the best food on the planet, they'll still vomit. Maybe they have a partial obstruction. Maybe they have some chronic pancreatitis. maybe, maybe, maybe. You get where I'm going? There's a lot of different things. What I can tell you is this is not normal. What I'm looking at right now, not normal. You need to talk to a vet and get some tests run, because if you are feeding a high quality food and the cat's still vomiting, well, that cat feels terrible, first of all. Vomiting is never normal, no matter how often they do it. And you need to get some help on eliciting what that issue is. Okay. Warner Broken. Hello. I'm so glad for this. I am so glad for you too, my friend. Thank you so much. Okay. I see another question about raw food, but I'm not going to talk about that again. Here's a cool question. Is the Assisi Loop effective for arthritis pain? So the Assisi Loop is this cool piece of technology. I'm going to their website right now so I can look. It's a FDA cleared targeted pulse electromagnetic field cool technology, right? Device that you can use to decrease pain, inflammation, accelerate healing, and reduce anxiety without drugs or side effects. It is as cool as it sounds. So, targeted pulsed electromagnetic field therapy is it's therapy that's like a sound therapy. It's around electromagnetic waves that are targeted at specific frequencies to stimulate an animal's natural processes, right? This is peer-reviewed, clinically proven, lots of good stuff. So short answer, it's definitely worth a try. And if it helps, that is amazing. And that way you could be able to manage your cat's arthritis with maybe not having to use non-steroidal anti-inflammatories. So okay, here is a question about panting after playing. Is it healthy for your cat to pant after playing? Okay, so in general, panting is not normal in cats at all. Panting means that cat is stressed, in pain, having issues with regulating their temperature. Yeah. Now, sometimes after a super, super vigorous session, they might pant for just a little bit after, but they should be able to bring that respiratory rate down into a normal zone fairly frequently. If they don't, then that lets you know that there's something going on with the respiratory cardiovascular system and it needs, you guessed it, a vet. So what's normal in a cat's? It's normal for cats at rest to breathe anywhere between 15 and 30 breaths per minute. So the only way you can count a cat's resting respiratory rate is, the best way to do it is when they're sleeping. So you sneak up on them and you count their breaths. And an inhale and an exhale equal one breath. So inhale, exhale, one. So count it for 30 seconds, multiply it by 2. And if their resting respiratory rate is between 15 and 30, you're probably fine. Okay. And again, I say probably because this is not medical advice. Remember, if it's above 40, not normal. Talk to a vet. Okay. All right. I'm going to do one more. And TriTrichomonas fetus. I got one more. Why do I have the 2 best cats in the world, Chris? I don't know, honey. You're just lucky. Okay, so there's a couple of questions about TriTrichomonas fetus, which is a parasite. Again, friends, I'm going back to my book. So TriTrichomonas fetus is a parasite that is in cats. And I have a question on treatment of it. So let me see what I can do here for you. Okay. So trichomoniasis in cats. The standard treatment, according to my book for TriTrichomonas, is metronidazole, which is an antibiotic. And those animals are often also infected with Giardia at the same time. So first things first, make sure that you are getting the correct diagnosis. And secondly, make sure you're treating for multiple infections at the same time. Thirdly, finish the medication entirely after it's prescribed and go back and have the poop checked again, because you want to make sure that whatever it is totally gone. Okay? All right. My beautiful friends, my beautiful cat lovers from all over the world, it is time. Our hour is up, and I feel like I just scratched the surface of what you guys started. So, there's one more question. I have to answer this before I go. I'm sorry. Is feline upper respiratory infection affected cat contagious to other cats? Yes. Yes, 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 with a side of yes, that cat is going to spread their cold and flu everywhere. So make sure that your cat that is infected is isolated from other cats until all of their symptoms are gone and you have got a clearing from your local veterinarian. Okay, so that is all I have for today. I apologize for everybody who I did not get to your questions. You guys are amazing in that you ask such insightful, beautiful questions. I really strongly recommend that you head on over to the All About Cats forum. There are forums in there about healthcare, and there are actually veterinarians that hang out in there and answer questions. So if you have questions that I did not get to today, go to this forum, put your questions in, and see if you can't get the help that you need. Other than that, I am so grateful to be able to come here and spend this time with you today. Thank you so much. I will be back next month. The last Tuesday of every month is when I tend to do these. So next time, if I didn't get to your question, hop right on at the beginning and pop your question in really quick, because the higher it is in the pile of questions, I can get to it. So anyways, mwah, mwah, mwah. So much love to all of you. I hope you have a beautiful month, and I will see you guys next month. Okay.